Murray Jepson, together with her husband George, founded the Tristan Jepson Memorial Foundation in 2006 to raise awareness of the causes of depression and anxiety in the legal profession. The foundation was named in honour of their son, Tristan, a young lawyer and comedian who suffered from clinical depression and took his own life in 2004. Last month, the foundation launched what could very well be the most significant effort so far to curb the high rate of depression in the law. Today we speak with Murray and Tristan Jepson Memorial Foundation Director and Guidelines Subcommittee Chairperson, Jeremy Hyman, about the world first psychological wellbeing best practice guidelines for the legal profession. So congratulations on launching the guidelines. You already have over 40 signatories and 25 of which are private practice firms. Do you believe this shows as a genuine desire among legal organisations to change their workplace to one that promotes psychological wellbeing?
Well, I would say absolutely. I've been really encouraged by the response, and I know as a foundation it exceeded all our wildest dreams in terms of a starting for this campaign. So, no, it's really a remarkable testament to the work that's gone in over the last couple of years on these guidelines.
Could I just add, I think that what's exciting is that we have a conservative and risk-aversive profession, and within literally 6 weeks of the release of the guidelines, we have this number of organisations who have become signatories, and that they're willing to take a risk because there's no actual chartered path that other people have taken. It's an initiative that's a world first. And they've got the courage and the wanting and the desire to lead the profession. I think that's what's incredibly exciting as well, is that there are people wanting to make changes, and they've demonstrated that by becoming signatories.
And the guidelines are comprehensive, as you've said, and firms are not expected to implement all of the guidelines overnight. But if there was one element that you'd single out as something you'd like firms to take away from these guidelines, what would that be?
Well, I would say engaging staff and involving your staff, because feedback from staff and staff involvement and feeling valued and feeling recognised and part of the organisation's vision makes such a huge difference to psychological health and safety of individuals within firms, and it improves the workplace morale and culture, and I would say that would be a major factor.
And I'd agree with Murray, and I feel it comes down to civility in the workplace, thanking people for doing a good job, acknowledging their efforts, really being part of the workplace and the camaraderie and people feeling connected.
And there's always the question of billable hours, which have been criticised as contributing to depression by forcing lawyers to work long hours, and in doing so they sacrifice sleep, social events, exercise, healthy eating habits, all of which we know contribute to good health. Would lawyers be better off from a mental health perspective if firms ditched the billable hour?
Yeah.
Well, look, I don't think it's a really matter of billable hour. I think it's a matter of working hours and acknowledging that lawyers can work long hours, and when they do, that they're acknowledged for the time they put in, whether it's time at the end of a transaction to recoup from the period that they've just been through, whether it's giving them more support during the type of work that they're doing, or whether it's just simply allowing ways and means for their day to be a less stressful day, and taking care and asking how they're doing and are they okay. So I think it's more about working hours as opposed to whether you attach the term billable or not. It's about what we would all expect in a workplace and making sure that we're supported and cared for.
The financial crisis has resulted in the change in business being available for legal organisations and firms. And they are being forced to be more efficient, more productive, to look at their costs. And I think in terms of that, they will need to make changes as to what's profitable and what isn't. And hours worked and the efficiency of that, and how at the same time to support one's people, will be challenges that will be discussed with the implementation of the guidelines. But I think it provides an opportunity for change and doing things differently, and not every organisation will be the same.
So the guidelines discuss some of the business benefits of a workplace that promotes psychological well-being. What do firms have to gain from taking steps to tackle depression among lawyers?
Well, I'd first say that the guidelines are good for people and good for business. The two aren't mutually exclusive. They can work together. I think that what the research shows, and even recently a PwC report put out by Beyond Blue, which talks about the amount of investment you put in and what you get back in terms of mental health outcomes, is only but good for the people that are in that organisation and the outcomes for the business itself. So I think we can work together to achieve both ends, and I think that an engaged, happy workforce is always going to be a more productive one.
Could I just add to that certainly the research shows that people are more productive, they're more efficient, that there are less risks for organisations, less insurance claims, that there's more pro-social behaviour in the workforce, and improved psychological health and safety seems win-win.
And just finally on working hours, should legal entities such as law firms and barristers' chambers seek to include regulation about working hours, possibly as part of an OH&S policy, within their strategies around mental health?
Well, I think that it will, certainly I believe that psychological health and safety will be part of OH&S, right? I don't think that that will be an issue in any shape or form. I think having regulations about it will put an extra burden on firms, particularly small firms and sole practitioners who are already burdened by lots of regulations. And so I think that one should be very cautious about that. However, I do think that the guidelines will inform the law, and I think that will be a way. Over time, and I think that's the thing to stress, there's no magic cure at this point in time. This is an ongoing and sustained improvement process that the guidelines are looking to implement. And over time, it is going to make a difference.
And, you know, I feel that where we're at currently with the guidelines is just a starting point of this journey. And I think every year we will add to the guidelines in terms of what we understand from the signatories that are involved in the best practice, and we will try to evolve as we move through this process to make sure that it's reflective of industry and what works tangibly in the workplace. But again, I reinforce Mari's point that it's about demonstrable commitment to doing positive good and change, and I don't feel that that in any way, shape or form is limited to a specific way. I think there's going to be a number of ways to achieve it.
Could I just make one point? The guidelines themselves are research-based, so they're not going to change, right? What we will be changing and adding to will be the implementation package and what we're looking to see, and to showcase and highlight the positive things that organisations are doing and individuals are doing to make innovative change in their organisations. That's the thing we'd like to know, to give people ideas, to recognise the efforts of people. But the guidelines themselves, until the research changes, are as they are.
I'd just add to what Mari said, in that we spend so much time in our workplace in terms of our lives, and the stresses and the day-to-day and the environment that we're in. It's so crucial to how we feel in terms of our mental health. And so I feel that what we're doing here is a really important part of the puzzle in terms of supporting our people. And I think that there's a movement afoot to really focus on the workplace. And I think this is the time and place now for us as an organisation to be focused on this. And I feel that we have got a great support behind us in these early days of the guidelines.
And we've also, I think, provided a mechanism whereby, one, it lists the factors in the workplace that cause stress, and a mechanism for how one can improve things. And I think certainly we've had some feedback to say, well, we didn't know what to do or what things to look at. Well, here they are itemised, and it's a starting point. And that's what we're looking at, is for people to start this journey. And it will be a journey.
And you've both spoken on the ways that you're going to develop the guidelines. Is there anything else that is on the radar for TJMF over the coming months? Anything else that you're working on?
Well, I think that in specifically speaking about the guidelines, we're very keen on how we can make them even more relevant and applicable to sole practitioners, to barristers, etc. So we're looking at how we can harness the knowledge and the skill set of people within industry now to interpret the guidelines and come up with a model for implementation that maybe speaks more to the sole practitioner. So I think that's an area of focus for us. And also I think, which is testament to where the foundation started and what we feel is very much our centrepiece is the lecture, our annual lecture, which we would be working on now and all the way up to the lead up to in October, and that's always a big effort. So we're looking forward to that.
I would just say that the guidelines certainly are a framework for organisations, but part of that as well is personal responsibility for one's own mental health or psychological health. And it's allowing people, one, to choose to have that, but it's also empowering to say, look, these are the areas you can look at to make choices in your life. And having that power also improves how you relate to a work situation or any other. And so those two factors for organisations and also for the individual is what the guidelines are about. And it also helps organisations if their people are responsible and say, hey, listen, I'm struggling with this.
Well, thank you both for your time and good luck.
Thanks so
Thank you
much.
very much.